name's Peter Guthrie. I'm a pharmacist here in Australia. I'm based in Melbourne, which is in Victoria, and I have a couple of different roles. One of those roles is with the Pharmaceutical Society of Australia. That's our national pharmacist body. We represent all 36,000 pharmacists in Australia and their professional interests. And I have a role in the strategic policy team. And I also have a role with the international engagement angle, which is part of my engagement with FIP, which has been formalised. I'm also a community pharmacist working in an after-hours role in a community pharmacy. And in that role, I've been a pharmacist immuniser probably for about 5 or 6 years in the immunising capacity. Immunising for pharmacists started in Australia about 2015. We're going to talk about a few different things tonight. Or this morning, depending where you are. It's definitely nighttime here. The first of those is I'll talk a little bit about where Australia's at with vaccination in older people, and then that will talk a bit about what pharmacists are currently doing, and we'll be able to do more of in the future to help. We'll talk through some of the factors that are a really good indicator of vaccine uptake by both health professionals and individuals, and how we can use that framework to really build immunity within the community and increase protection through wider reach of vaccination, and then talk a little bit also about sort of what that looks like for patients and for pharmacists. But context is quite important, and the next slide talks a little bit about Australia specifically. We're a very large country in size, but a population of only 25 million individual people. 25% of the population of Australia was born overseas. 50% of people who live in Australia have a parent that was born overseas. And we also have 1 to 2% of the Australian population are First Nations people. That's our Aboriginal and Torres Strait Islander population, the world's longest continually surviving culture of over 60,000 years. And each of those demographics and population makeup affects how we, as health professionals, support our population's health. And I think the other factor about Australia is that our population is very much based on the eastern seaboard. If you sort of take this, or our eastern 3 states and part of South Australia, 80% of the population rests there, and the rest of the country makes up about 80% of the land mass, has about 20% of our population. This slide also describes the fact, and I've mentioned states a little bit already, like many countries in the world, we have multiple tiers of government, and different tiers of government deal with different aspects of our health system. So our federal or national government, we have a regulatory body, the Therapeutic Goods Administration. They register the vaccines. They deal with the registration and sharing of information for that. The federal government is responsible for the funding of primary care and effectively forms the role of a single payer in Australia. So primary care, we have a Medicare system where people can access health services through Medicare, through their doctor, or through the cost of medicines for their pharmacy through the pharmaceutical benefits scheme. That is through effectively a single payer model that does have some co-payments. There is a much smaller role for private health insurance in Australia. And our federal government also operates our National Immunisation Register and electronic health records. And some of those structures have been really important. Our National Immunisation, or our Immunisation Register, is now a mandatory place to record all of the vaccine events that occur in Australia. For the vast majority, they get uploaded within sort of 10 minutes to 24 hours. And so increasingly becoming a cradle to grave record of someone's vaccine history. They also operate electronic health records, and they also coordinate Australia's vaccine policy through an expert advisory group, which is made up of vaccine experts and a whole range of really important voices. And probably most Australians hadn't heard of those until the pandemic started, and we heard a lot about their work. The Commonwealth also supports the vaccine providers like pharmacists and general practitioners through various support programs they run through what they call primary health networks. They're like local networks that go out and provide support. Our state governments, however, have the responsibility for health in terms of the legal framework that we work under. So they regulate our health services, and that includes our medicines and our poisons laws. They are responsible for the operation of public hospitals and the funding of those hospitals, but also the regulation of practice that occurs within them. And they also distribute government-funded vaccines on behalf of the Commonwealth. And in terms of our vaccinated workforce in Australia, we have pharmacists, nurses, and medical practitioners. Nurses and pharmacists require additional qualifications, whereas medical practitioners, that's part of their early scope. And we've had a lot of success, I guess, through the COVID-19 pandemic in demonstrating a wider vaccination workforce. This slide really shows that once there was enough vaccines available, community pharmacists, and this is a graph of all the vaccines delivered by community pharmacists in Australia, that community pharmacy really provided a huge booster to the rate of vaccines that were able to be delivered. And then as we moved out of the sort of acute phase of the pandemic in late 2021 and other providers scaled back our government vaccination hubs and GPs returned to their normal work, community pharmacists have taken on the lion's share of the vaccination effort in terms of the various booster doses that have been recommended. And we now have community pharmacists administering over half the vaccines for COVID-19 doses in Australia at the moment. And the next slide just has a lovely hero shot showing that that's over 11 million doses, and from 36,000 pharmacists in the country, we think probably about half to maybe a bit more might be trained and authorised to administer COVID-19 vaccines. That's a really outstanding achievement. But the photo also demonstrates that part of that work has come through outreach work, where pharmacists have gone into aged care homes to administer vaccines, into disability care facilities, and conducting home visits. And those are really important things to be able to continue doing if we're looking at supporting older people through vaccination into the future, because what worked really well in the pandemic is we looked really closely at all those things that make it easy to be vaccinated. And when we talk about the 5A model in a sec, that will become quite important. We did very, very well with in aged care early on. We haven't done so well with the boosters with aged care. But I think this graph's a really interesting one to show opportunities for pharmacists playing a greater role. This graph shows all influenza vaccines administered in Australia over the past 4 years. It's an equivalent at the end of July, which is the kind of the middle of our winter, which is by that stage, most people who've going to get an influenza vaccine will have received it. And the little blue bits at the top represent the number of doses administered by a community pharmacist in a community pharmacy. And the grey and the dark grey is doctors, and the light grey is others, such as nurses that might run nurse clinics. What's really notable about this is we've gone from around 15% of vaccines for influenza being administered in a community pharmacy prior to that national rollout of the COVID-19 vaccine to nearly sort of a quarter now. And that's really sort of a 60 or 70% increase in the percentage contribution, reflecting a very strong acceptance of the role community pharmacies now play. There were some other levers in there which helped with that. But we start from a very high rate of success in Australia with, say, influenza vaccine in older people. For people over the age of 65, they have access to a free influenza vaccine every year. Traditionally, they would have got that from their doctor. Increasingly, there's a choice of providers now. Over 80% of people in that age bracket currently receive an influenza vaccine most years. So even though the raw numbers you'll see in the total population in Australia jumps around a little bit each year, that variation is predominantly seen in people under the age of 65. People over the age of 65 are very, very good at going and getting access to the influenza vaccine. The next slide then shows, well, what can pharmacists do? And don't get overwhelmed by the slide. It's mainly to create visual impact. These are all the vaccines that we currently have in the Australian Immunisation Handbook along the top, and then all the states and territories down the bottom. As I said, every state and territory has different regulations that apply to what you can and can't do. And there is state variations. I practice in Victoria, so I'm able to administer vaccines, say, for pneumococcal to people over the age of 50, but my colleagues in Western Australia, the cell under that, cannot at this point in time. The green represents the minimum age. So if there's a number there, that's the minimum age to which a pharmacist can administer a vaccine. If it's a tick, it's to all eligible ages. But what the next slide does, and I've tried to pare this back a little bit, is it demonstrates these are the vaccines that are routine recommendations for people who are over the age, say, of 50 or 55, 60 years. And so you see influenza, pertussis every 10 years for a large part of that cohort, COVID-19, pneumococcal, herpes zoster. Those are the vaccines that most pharmacists in most jurisdictions currently have the authority to initiate and administer that vaccine. So that provides us with some really great opportunities. I've left some other ones there on white backgrounds. They reflect vaccines that perhaps aren't routinely recommended because of an age group, but they may be recommended to people who are older because of other aspects of their lives. So whether it's if you're living with immunocompromised people, there might be a vaccine recommendation there, or in the case of Japanese encephalitis, we've seen that now become potentially an endemic disease in parts of rural Australia, and there are now recommendations in, if you live in rural Australia and spend time outside, such as an older person who does gardening, that's now becoming a routine recommendation for that population group as well. So what we can, I think the takeaway for that slide is that there's of all the vaccines that people over the age, older Australians might need access to, pharmacists have the authority to authorise and administer most of them in most states, and we'll see more of those get coloured in shortly. This was something that was developed in 2016. It was a study that was done that looked at how do we know what vaccines, or how do we know what improves vaccine uptake, and how do we categorise that? And it looked about 43 odd different studies from around the world, and established 5 very clear domains, which all happen to start with the letter A, as they sometimes do in research projects, to look at what are the predictors of vaccine uptake. And they were really clear in the end. So access, affordability, awareness, acceptance, and activation. Now, I'll just take a couple of minutes to go through each of these. Vaccine uptake from access point of view, if your workplace recommends it or your university or school recommends it, that's going to make it more likely for you to take up the vaccine. When they looked at older people who may not be working anymore, what they actually found is that people who had really frequent contact with their healthcare team had a higher vaccination rate than people who had infrequent access with their healthcare team. And people who had a chronic disease is probably a really good predictor of influenza vaccination. So that's probably partly their engagement with their doctors and other part of the healthcare team. It also provides an opportunity for community pharmacists who will see their older patients perhaps every month, perhaps every 2 months in relation to accessing medicines. Convenience is also very important. Affordability, they specifically looked at the impact. I think there's an American study that said, what happens if you gave out vouchers for free vaccines? Well, they did this in elderly patients and found a really high uptake of vaccination. And we've also seen that in Australia through the National Immunisation Program, where people who have access to free government-funded vaccines are much more likely to take it up than those that do not. And the activation, so the degree of providing structured reminders, whether that's a text message service or whether that's something else. So we think about those 5 A's. The next slide sort of talks about some of Australia's strategies for trying to do those. So we have both our general practice network, but we also have a community pharmacy network that is able to help improve access. And the barrier to that being really more widely uptaken up has been previously our access to government-funded vaccines. And from the first of, and our ability to have the administration fee to administer the vaccine, the professional service, being paid for. So from the 1st of January next year, the Australian government has announced that people will be able to get any NIP vaccine that a pharmacist is legally able to administer, that they'll be able to get that at a community pharmacy. They'll be able to receive that free of charge, and the pharmacist will receive a payment of 19 Australian dollars. So that's sort of about 12, 11 euros for that professional service. So the vaccine is free of charge, and the consultation fee has been met by the government. And we think that's going to be really important in improving uptake. Awareness is also very important. So the strategies to increase awareness are really about focusing on communicating a personal benefit and discussing the vaccine schedule with the individual. I'll talk about how we might do that with an individual in just a second. Acceptance, so the strongest predictor of vaccine uptake is a strong and clear, unambiguous recommendation from a healthcare professional that's based on that individual's needs, not general needs, but that person's particular needs. And the activation, so those prompts and reminders, how do we actually help those occur? So the next slide, I've got 2 potentially quite typical situations. On the right-hand side, we have an image of a pharmacist who is supporting an older person with accessing a regular medicine for a chronic disease. And on the left-hand side, we have a pharmacist who might be doing a medication review in a private room. In this case, this is a pharmacist that is working in a general practice who sees patients to talk about their medicines and other things. In those longer consultations, the way you might bring vaccination up in conversation is you might routinely check the immunisation register as part of that practice and that service that you provide to identify potentially due or overdue vaccines. So that could be during a medicine review, during a multidisciplinary care case conference, or even if someone's come out of hospital recently following an admission, you might look and see what might be missing there. You may have opportunistic vaccination events. The patient may raise the topic with you. Sometimes I work in a pharmacy that has a TV with a news channel on behind us. Sometimes that will prompt conversations about vaccination, and you can sort of have a chat about what vaccinations might benefit the individual. But I think one of the most powerful events where you can sort of engage older people with vaccines that they may not have considered in a vaccination event for something else itself. As I said, 80% of older Australians will receive the influenza vaccine every year. You're required to check the immunisation register before you administer a vaccine. And so that's the perfect opportunity to identify what vaccines might be missing, what are the person's individual needs, and how else can you engage them with vaccination? And then have that conversation about how that then impacts on the quality of life. I think the summary is that there is a huge role for pharmacists to play. We are living in a country that is struggling to meet the health needs of our population in primary care because we have an overload in our general practitioners. So community pharmacy will increasingly become a bigger part of our vaccination workforce, and older Australians make up a big part of that. There is strong public trust in pharmacists in Australia, and that is something that is really important if you're going to be talking about something that people may not self-identify as a health need. And I think the other aspect is that sometimes it's a bit easier to get into a pharmacy than it may be to get to that access angle where you might need to make an appointment to see a pharmacist for a vaccine, but you can probably get that appointment. Other providers may not be as readily available. We generally have longer trading hours.